Hello there, I'm Dr. Paul Charles. I'm going to talk to you today about the length of action of botulinum toxin or Botox. Many patients come into clinics saying, oh, my Botox hasn't lasted, etc., etc. I think there's a variety of reasons for this. The first is when you inject botulinum toxin, it gets into the neuromuscular junction or the nerve cells and stops the release of acetylcholine, which is the message that sends from the nerve to the muscle to tell it to contract. So when you inject, it takes a while to be absorbed into the cells, then gradually it knocks out various neuromuscular junctions and the muscle movement gets less. In time, your body breaks down this toxin and muscle movement returns, and also you grow new neuromuscular junctions. How long this takes depends on the person, but 70% of people do have significant movement after about 8 weeks. And certainly by 12 or 16 weeks, people have quite a lot of movement. Whether this is that it's not worked is not the case. It's just the natural progression of the muscles starting to move again. Now, if you use the right dose, which is called a ceiling dose, effectively you're going to knock out as many as you can, and if you keep adding to that dose, it's not going to make any difference. So it really is, if you place the toxin in the right place on the right dose, you should get an effect. Sometimes people don't get much of an effect, it's quite rare, and those people have antibodies, probably about 1 in 200. And some people just break it down more quickly than others, and certainly exercise may be a factor. The more people exercise, the more quickly it breaks down, and zinc may help to preserve its longevity. Clearly, if you come back, say, every 3 months, as most people do, you've still got some cumulative effect in that it hasn't quite worn off before you have your next dose. And this sort of adds to the longevity of it and sort of maintains it. And also the muscles begin to waste a little bit, and you lose the ability to make expressions, so you get less expression habit. So all those things contribute to it working for longer. Now, the other thing that is interesting is that there are new botulinum toxins on the market which definitely last longer. How long they're going to last is not absolutely sure, but the research shows longer. But the same effect will happen there, just sort of further down the road. So when you have botulinum toxin treatment and you think it hasn't worked, it possibly isn't due to the fact you've been given duff toxin or the person doesn't know what they're doing. It's just a natural effect of botulinum toxin. So if you go to a good clinician who knows what they're doing using a prescribed botulinum toxin, it should work quite well for at least sort of 2 to 3 months, and then you may need a further treatment. So I hope that helps to explain what's happening. If you've got any queries, please do get in touch. Thank you very much indeed.